There's new guidance from the CDC about how the coronavirus can spread. David Bengod has reactions from the medical community.
It's not a surprise to any of us. We've known for months that aerosols played an important role in the transmission.
He is Dr. Michael Osterholm, an infectious disease expert at the University of Minnesota. He says the CDC's updated guidance on how coronavirus spreads is finally starting to reflect the science.
What essentially are they acknowledging now?
The CDC is finally acknowledging that these very tiny particles that can float long distances and hang in the air for hours are actually part of the transmission of this virus from an infected individual to someone who's not yet infected. That has tremendous implications.
The guidance now on the CDC's website specifically states that the virus may be able to infect people who are further than 6 feet away, especially within enclosed spaces that had inadequate ventilation, and if someone is breathing heavily while singing or exercising. There is a report from the New York Times that says scientists at the FDA are being blocked by the White House from implementing strict new federal guidelines for the emergency release of the vaccine. Those enhanced safety guidelines would almost guarantee no vaccine would be approved before the November election.
The FDA has good reasons for doing what they're doing. They have career scientists who develop these kind of models of what you need to do to assure safety and to assure efficacy. And right now, this is what they said, and we'll see what happens.
And new research reveals marijuana users may need more anesthesia and pain medication during an operation. The University of Colorado study looked at 118 patients who had surgery for a broken leg. It showed patients who used marijuana required more anesthesia than non-users. They also reported higher pain sources while in recovery and got 58% more opioids per day while in the hospital. Experts say patients should tell their anesthesiologists if they use cannabis products. And having a spouse in hospitals' intensive care units could put your own health at risk. That's according to a new study from Japan. Researchers tracked 7,800 husbands and wives of patients admitted to the ICU. They found those spouses had an increased risk of having a heart attack, stroke, blood clot in the lungs, or chest pain within the mouth. Experts say this is likely due to the psychological stress of having a critically ill partner.